Good Shepherd Pharmacy was started as a charity pharmacy that had about 250 drugs that were free for low-income and uninsured patients. We're different in that we do not bill insurance. We don't bill any third parties at all. We charge our members a monthly membership fee that they can afford, but also we work with people to meet them wherever they are. And what I mean by that is we fill prescriptions on a 90-day supply, but we charge a monthly membership fee to make it work within their budget. I tell people all the time I didn't have a grand idea for what Good Shepherd has become. It really started very simply, and that was the Lord called me to start a ministry to help people with their medicine. But we didn't have any revenue, we didn't have any money. And so every step of the way has been just having faith that the Lord would provide, and He has every single step of the way. But I mean, it's been difficult. It has been. It's been really difficult. However, all of our best innovations, like group synchronization, synchronizing 1,000 patients to the same schedule, no one's ever done that before. All that was born out of not having resources to staff up and have a big staff. And so wonderfully, those struggles have been blessings. I can see it now. It sucks when you're in it, it really does. But 5 years in now, I can definitely see how the Lord used all of it and provided every step of the way. Here we are. We had a free space in the Hickory Ridge Mall that we were able to open a pharmacy in. We were able to get free medications through a nonprofit wholesaler. And just one thing after another snowballed into the multiple programs that we have today. The free pharmacy technician program, the prescription recycling program called Remedy Chain, and of course our assistance program. Over the course of the last 5 years, we've grown our list of medications to just about 400 generics. We're able to source brand name drugs, and maybe most importantly, we're now able to get an unlimited supply of insulin that we connect with patients as well. I tell people all the time, we have every pharmacy resource that there is. After 5 years, I'm familiar with everything that's available. And so that's why a big part of me wanting to reach out to CCHF was to say, man, it's time to talk to physicians. Whatever scope that you're interested in, whether it's a drug closet or a dispensary or opening a charity pharmacy, like we can help with that. But we were only licensed in Tennessee, and that was kind of where we were limited in partnering with CCHF. Last year, we got some funding, enough to license in 35 states, and we've licensed in 22 of those 35 so far. I've got applications in process. And with that in place, now we can really help. Now we can help anybody just about anywhere. Our biggest challenge right now is just reaching more patients. And also it's just different. Like, people don't understand. They've never heard of a Good Shepherd pharmacy or a membership pharmacy, and what does that mean? So just getting the word out on that is our biggest challenge. But we've learned through the process that we come together as a total healthcare team with what we have to offer, that, man, we can really affect lives. And so I want to connect with people who are interested in providing their patients with pharmacy services, prescription medicines obviously, but also other pharmacy services like transitional care or disease management, chronic care management. We're doing all aspects of clinical pharmacy through here. It's maybe unusual to think of pharmacy as a ministry, but if you take a step back and you think about it, people come to us in a crisis. And it's cliche to say you earn the right to share the gospel. It's really not that, but you do have to build a relationship. So when you walk with someone through that, you create a relationship that does set the stage for sharing the gospel. That person learns that the next time they have a crisis, they do know where to go. And not just a pharmacy crisis, they know who the Christian in the room is. And what we have is hope. What we have is hope in Christ. And we have folks come to us that, for example, have just lost a child and don't know how they're going to make it through the next day. And we can help them with antidepressants, but we can't help them with hope for the future. And so that's where Christ comes in, and that's where we're able to share the gospel in those things. And it happens in those tender moments. It's not a gospel tract, and it's not a systematized way of email structuring your messaging. It's meeting people in their suffering is where it really happens.